Orthopedics is probably the most carpenter-based, which is kind of the way I grew up. When I got into medical school and was looking for which way to go, I think orthopedics was the first one that actually used drills and saws and things that I was used to.
I like being hands-on. I like the sports medicine aspect of it because I love using the power tools, and I love the immediate feedback you get with patient care. You know, and we can take someone who basically is wheelchair bound one day, and the next day they're walking, and you give them back their life, and it's really rewarding.
We always provide the most innovative care. We've been the leaders in almost every facet in total joints, from the jiffy hip to the quad sparing knee to custom knee replacements. We've been really on the forefront of all these issues as they come through the research industry. We actually participate in a lot of research to help develop and test the longevity of the implants that are being used.
The primary goal of Hampton Roads is to be as innovative as we can. I have in my left hand this very shiny disc. This disc was designed to be put in the knee between the femur and the tibia. What's distinctive about this group is that none of us put this in. I've taken out a lot of these because they all failed. So you got to be able to vet a particular technology to decide whether it's good for your patient or not. Contrarily, take this implant. It's designed to solve one single problem. This goes into the tibia just like this onto my knee. This piece of equipment is truly an innovative process. We chose to put this in. We vetted it, we looked at it, we studied it, to be able to discern between what's not so innovative and what truly is innovative.
There's a big push for minimally invasive surgery. I think the more important point is surgery that's done properly. The word minimally actually means the least amount necessary, so the surgeries we all do, I hope, are minimal, where we're doing the least amount necessary to get the job done. Do it in a way that we harm the patient as little as possible to get them better.
In 2005, December 2005, I started doing the anterior approach. Started doing it full-time in March of 2006. I believed in it, and most importantly, the patients did really well. I kind of became known as the hip guy, and what I'm probably most proud of, it changed the way hip surgery is done in this area.
The direct anterior hip is probably a great way to do a total hip replacement in order for a person to restore his function and begin his normal quality of life in the most rapid way.
Probably the biggest thing that we're using these days as far as knee replacements goes with the Mako system, which is a computer navigated system.
No matter how you do any of these procedures, right? Number one thing you have to do is they have to be well positioned and well fixed. What the Makoplasty allows you to do, or helps you do, is positioning the components accurately.
The computer has a robotic arm that you program based on a preoperative CT scan, and you can pre-plan exactly where you're going to put the implant in. The robotic arm helps guide you so that you take away only that bone that's required, and you can do it through a fairly small space.
And so even though I'm still doing the operation, I use this robotic arm to then assist me based on the information that I gave it, so we can accurately position the components. And you can use it for both hip and knee.
We're trying to get patients back on their feet without the surgery, but if they don't respond or they have a condition that needs surgery, we're able to provide top-notch care that's amongst the best and most innovative that's out there.
I think, like most doctors, the part that I love about being an orthopedic surgeon is being able to help people. That's a big part of our job. Almost everybody that's coming in has some kind of problem. They have some kind of pain, there's some kind of issue, and what we can do can change that.
And that's where I think experience is so important. I honestly think there's not one thing that I haven't seen or experienced in the OR.
It's the reward of seeing the patients come in the office and being thankful. It's surprising how many patients come in and give you hugs and say, you changed my life. And so that just makes you want to do more of it.